Thanks for joining me today. I'm just giving an update on the medical schemes and the risk of many of our patients losing their medical aid cover over this very difficult economic time. As you might be aware, we did send out a survey and we have tried to actively lobby over the last few weeks in an attempt to mitigate the risk that is associated with the economic downturn that we're currently all experiencing. And it's not only about rare disease patients, this is going to be an issue for the chronic patients across the sector. So we did a short survey at the request of Council for Medical Schemes when we started with this advocacy process, and they requested some substantiated data from us. And based on the 350 responses, we closed it at 350. The average medical aid premium for a rare disease patient is 6,300 Rand a month. So that's significantly higher than most. And it's, it goes without saying, as many of our medical aids, we are on higher plans, medical aid members are on higher plans due to the fact that they have chronic conditions. 40% of the respondents stated that they would not be able to pay their medical aid at the end of April, which was obviously a massive concern for us as an organization. 19% did have a positive medical aid savings balance, which has been made available to them to pay for their premiums. However, unfortunately, of the 19%, 49% of them did not have enough in that medical savings account to be able to cover a full month's premium. So it's not really a workable solution. So essentially, we applied to Council for Medical Schemes, bringing their attention, obviously, to the fact that this is a massive concern for us as an organization. And the request was that they consider allowing us to access the medical scheme reserves to counter the economic impact during this time and to try to cover patients. Obviously, being insurance, they haven't been able to provide payment holidays and all of that jazz, as many car repayments, bond repayments, bank repayments, etc., have offered various economic and fiscal opportunities to be able to provide some stability through this time. But that obviously has been a little bit more difficult from an insurance perspective. So Council for Medical Schemes did in fact engage with the medical schemes, and they issued out a circular on the 26th of March, and that circular stated that Clause 3 of Circular 25, termination of membership due to non-payment in the spirit of social solidarity as outlined by the President during his address to the nation on the 23rd of March, the CMS requests that schemes investigate all disruptions to member contributions on a case-by-case basis and determine the merits thereof prior to termination. So basically, that was a soft plea from Council for Medical Schemes requesting that all medical aids actually inquire as to the reasons prior to terminating patients. And then another one went out on the 3rd of April in the form of a press release. And the Council for Medical Schemes said it appreciates that the provision of healthcare is the most impacted by the outbreak of coronavirus, and that why the CMS has encouraged grace towards medical scheme members who are struggling with their membership premiums. The CMS takes guidance from the National Department of Health and is engaging with industry and relevant stakeholders on how best to ensure that that pandemic is funded. Engagements with medical schemes will differ according to member size, profiles, and members and the benefit packages offering, and will inform the ultimate decision. So those conversations took place, and we received an email as Rare Diseases South Africa this week, and it said, after lengthy discussions with the industry associations, the following was agreed by consensus: that individual members that qualify should seek relief through the medical savings dispensation, failing which individual members should apply to their schemes that their contributions be considered under ex gratia payments. So the decision to approve or not to approve lies with the individual scheme. That obviously raised a few red flags for us, specifically due to the fact that obviously the ultimate discretion lies with the scheme on whether or not to grant such an ex gratia application, and also that the ex gratia applications, if anyone has ever completed one before, you will know that it is a complex process and it's time consuming and it requires a fair amount of documentation. So we did ask if specific specific teams would be made available to review these ex gratia applications on a quicker turnaround. Um, and then it was made quite clear that unfortunately the only way for schemes to actually access this was if they had applied. And the email stated schemes that have not applied or have not been granted an exemption from council on the use of medical savings cannot apply this dispensation. So essentially what that means is that we as chronic patients are reliant on the medical schemes having approached council for medical schemes to ask them for exemption to be able to provide us with the option of paying your premiums with your medical savings or alternatively applying for an ex gratia application. And we know that not all the medical schemes have actually made this application. So this is essentially where we as civil society and as chronic patients across the board, regardless of what condition you're battling with, need to lobby together and apply a fair amount of pressure on our medical schemes as members, and plead with them to make sure that they do apply to council for medical schemes for this exemption so that they are able to give us the relief that is needed, the economic relief that is needed to ensure that we remain covered. We cannot, as a country, afford to have all of our chronic patients coming off their treatments, losing the medical aid cover, and then falling onto the healthcare system, the public healthcare system, for relief of our conditions. We know that the public healthcare system is already strained. Many of the rare diseases that we cover are not covered under public health. And also, the Department of Health is doing their absolute best to keep their hospitals, etc., relatively clear at the moment to be able to appropriately respond to the COVID-19 pandemic. So it doesn't help if we've now got millions of patients across the country who have generally been assisted in the private sector who've now fallen as a further burden onto the public health system. So this is me imploring all patients out there, regardless of what condition you have. We will circulate attached to this email at the bottom, not this email, sorry, this video. At the bottom, we will include the relevant circulars that have been issued by Council for Medical Schemes. We advise that if you are battling to pay for your medical aid premium at the end of now during the month of May, or even going forward due to a result of loss of income as a result of coronavirus, that you please email your medical scheme, submit them with the relevant documentation that has been issued by Council for Medical Schemes, request the use of your medical savings if you have a positive balance, and if you do not, request the use of this ex gratia channel to apply for that funding. And if you do have problems in this regard, please do let us know so that we can try escalate it from our side. Once again, it is reliant on your medical scheme having approached council for this exemption. If they have not done it, it's not going to be an available option. We need to make sure as members that we have pushed all of our medical schemes to actually doing this and applying for the exemption, and thereafter we can have the necessary relief, obviously by way of that process of either ex gratia or the medical aid savings. So that is what needs to be done at this point. This is a time for us to lobby together. It's collective bargaining. We all need to stand together and make sure that we get it done. So you are more than welcome to pop us any messages. Find us on Facebook, Twitter, Instagram, Rare Diseases South Africa. We will answer as many questions as we can. We'll try and assist as many people as we can. But this is definitely the time for us to all pull together. So I appreciate you listening today, and I hope that we can collectively make sure that we all remain covered. If you need anything, please let us know. Thanks. Bye.